Alzheimer's disease is the most common cause of dementia. It's characterized by a progressive decline in cognitive functions to a point that prevents independent living. It's caused by an accumulation of misfolded proteins throughout the brain that have the toxic effect of disrupting connections between brain cells. And that loss of brain tissue is ultimately fatal, with an average post-diagnosis survival period of only 7 years. The good news is that there do exist new drugs that prevent the accumulation of those misfolded toxic proteins. The catch is that while a dementia diagnosis is a relatively routine clinical activity, an Alzheimer's-specific dementia diagnosis tends to come late in the disease progression, where these drugs simply are not effective. They're also very expensive and carry the risk of extremely severe side effects. However, prior to the onset of dementia, there is an intermediate state called mild cognitive impairment, and patients with MCI are at specific risk for developing Alzheimer's because in a 3-year period, about 20% will progress to some form of dementia. And with that patient group, we saw the opportunity to create a system of early detection for pharmaceutical intervention in the treatment of Alzheimer's disease using a combination of neuroimaging and artificial intelligence. In our model of care, patients at risk for dementia may be screened for MCI by their doctor with a simple questionnaire called a neuropsychological exam. If diagnosed with MCI, they may undergo neuroimaging with PET and MRI. These are safe, reliable, and already established technologies that non-invasively acquire very detailed information about brain structure and brain metabolism. Finally, those images can be input to our AI model, and in consultation with a specialist physician that considers the patient's unique medical history and demographics, we then predict the statistical likelihood that they'll experience further cognitive decline over the next 3 years. If the patient is at risk for progression to dementia in that period, then proactive measures can be taken. The prescription of protein-busting pharmaceuticals, stimulating social therapies, arrangements for personal care, finalizing legal issues, and consenting to advanced medical directives. By considering the needs of a uniquely vulnerable patient group, we are developing an early warning system for the prediction of cognitive decline in at-risk patients. Our method will ensure that only those who truly require these revolutionary but expensive and potentially dangerous medications would receive them, to keep those who don't away from the burden of cost or risk, and all by taking to heart the commonsensical notion that an ounce of foresight is worth a pound of cure.